Well, good afternoon, and thank you for that wonderful introduction. What a great job. So I am Admiral Rachel Levine, she, her pronouns, and I am honored to be the Assistant Secretary for Health and to serve as the 4-star Admiral for the United States Public Health Service Commission Corps. I am also, as you know, the first openly transgender person in a Senate-confirmed federal office. And my appointment is very important. It paves the way for national leadership that is more reflective of the people that we serve. Representation is very important. And we already have the second trans person, Assistant Secretary Sean Skellett at the Department of Defense. So we're continuing to make progress. And so we must grasp moments as this as we celebrate Pride, as we celebrate Pride Month, or I'm calling it a Summer of Pride. And we have to celebrate how far we've come, but then also recognize how far we have to go to achieve health equity for the LGBTQI plus community. And I firmly believe that we have not made progress unless we have all made progress. Achieving health equity requires valuing everyone, but also means making focused and ongoing efforts to end inequalities, to eliminate the impacts of injustice, and to improve the health for everyone in our nation. Many young people in our country need empathy and compassion and understanding, and they often see few places to turn. In April of 2023, the CDC released a report called the YRBS, which comes out on a regular basis. This is the Youth Risk Behavior Survey, and it provides key data on behaviors, experiences among adolescents related to sexual behavior, substance use, experience of violence, mental health, and suicidality. But it showed that if these youth have one supportive adult, that can make the difference in a suicide attempt. Now, we'd like to think that that might be a parent or a relative, but it's not always a parent or a relative. It might be someone else in the community. Maybe it's a teacher. Maybe it's a school guidance counselor or a school administrative officer. Maybe it's their coach, someone else in their life. And that is one of the things that makes regressive bills like the quote-unquote Don't Say Gay bill in Florida so challenging, because it means the particulars of that bill really make it almost impossible for LGBTQ youth to talk to their teacher, to come out to their teacher, because the teacher is required by law to automatically report things to their parent, to essentially to tell on them and to report it to their parent, which means that the young person won't go to that teacher. Well, that might be that one supportive adult, that school teacher, school counselors. Now, I want to point out a program through Health and Human Services and SAMHSA, the Substance Abuse Mental Health Service Administration, called 988. 988. Simply dialing 988 will connect a person in need with a suicide and crisis lifeline. Now, it can also be text, because young people don't call, and it can be chat. It can be many different ways to contact 988. Suicide prevention for LGBTQ youth is a national priority, so they have a Click 3 program that if they text 3 or to their chat or call, then they will be directed to a specific LGBTQI plus trained counselor, actually through the Trevor Project. I do want to speak a moment about many of the hateful laws and actions being taken by states that are targeting vulnerable LGBTQI plus youth, particularly vulnerable trans youth and gender non-binary youth and their families, and even their medical providers. As Assistant Secretary for Health, I am urging us to base medical care on facts. Gender-affirming care is medical care. Gender-affirming care is mental health care. Gender-affirming care is literally suicide prevention care. It is based upon decades of study. It is a well-established medical practice with a strong evidence base and standard of care through WPATH, the World Professional Association of Transgender Health, with an update that was published in September of 2022. Based upon decades of research in medical evidence and analysis, and many respected medical organizations from many diverse fields agree that gender-affirming care is medically necessary, safe, and effective for transgender and non-binary youth, adolescents, and adults. So those who attack our LGBTQI plus community are driven by an agenda that has nothing to do with science. I can't stop quite yet. They have nothing to do with science, nothing to do with medical care. It is based really on political and ideological attacks on these trans youth and families. We can create a better, more inclusive future because what all of you are doing every day. There is a place for all of us in this great country of ours. Thank you.